nation's oldest city. Welcome into the show. This is Christian Ramos once again subbing in for Chris Phillips, the wonderful Chris Phillips. Hope she's doing well out there. And we'll just get right into it. It is the first Tuesday of the month, so that can only mean one thing. I am joined again today by a friend of the show, friend of the station, Dr. Jay Hartley. How you doing today, Doc?
Hey, good morning, Christian. Good to be here.
Great to see you again. Great to see you again.
Live on WFOY and on Facebook Live.
Yes, sir. Everybody tune on in. You got the office page up right now?
Yep, we're on Hartley Chiropractic and Scoliosis Center Facebook Live.
Yeah,
right
tune
now.
in live on Facebook to see the action as well as hear it all. How was the Super Bowl weekend? You were able to catch the game?
Well, I just wanted the team with the best chiropractor to win. So I'm friends with this 49ers chiropractor. I don't know who was taking care of the Chiefs, but he must have done a good job.
Clearly did a good job. Got him prepped up for the game. It was a lot of fun to watch. A little sloppy, slow first.
Yeah,
half,
I'll tell a good, unbelievable story about the 49ers back in the 80s. Roger Craig, who was, many of you guys know, he was a Hall of Famer for the 49ers in their Super Bowl days during the 80s. He went to high school across the street from my chiropractic college. He went to Davenport Central. And his mother started taking him to the Palmer College of Chiropractic Clinic during that time, being proactive, just trying to keep him healthy while he was playing football.
Wow.
And then he went on to Nebraska, won the Heisman Trophy. He kept up with his chiropractic care. And then he went to the San Francisco 49ers. Mm-hmm. And his chiropractor in college, Mitch Malley, in Red Provence, they were friends with a chiropractor in Santa Clara, California, Nick Athens. And so Roger Craig started to see Nick Athens. He told Joe Montana about it. He told Jerry Rice about it. And next thing you know, Nick Athens is seeing the entire 49ers team during that run in the 80s. And a really cool story, Joe Montana was a big advocate of Nick Athens, and Nick Athens was asked to be at a press conference before one of the Super Bowls in the 80s. And so he was there with all the medical doctors and the trainers, and they didn't ask him any questions at the press conference. And so Joe Montana was a little upset by that because he thought he was a big part of their success. And Jerry Rice had hurt his ankle and wasn't scheduled to play in the Super Bowl. And so Joe Montana talks to CBS Sports, and he says, hey, the night before the Super Bowl, I want you guys to come to my room, and Nick Athens and Mitch Malley are going to be there working on Roger Craig and Jerry Rice and I. And so they videoed it, and Joe Montana asked them to show them getting adjusted 30 minutes before the kickoff. Jerry Rice ends up playing in the game, and the rest is history. So they're really cool. So
awesome.
Yeah, so I visited Nick Athens' office, and he's got all the 49ers memorabilia all around it. And Joe Montana's dad was in there getting adjusted when I was there, and I was like, "Wow, I picked the wrong day. I met Joe Montana's dad instead of Joe Montana."
Yeah. What can you do? But there you go, folks. Stay on top of your health. There, get adjusted regularly, and you win Super Bowls.
That's right.
That's the one thing you can learn from this lesson here today. All right, Doc. So we'll get into it, but that's incredible regardless. So, but we'll dive into it. I know it's that time of year where snowbirds have been here for a couple months now, but they are still prevalent here. So
yeah, one common question we get from patients is, "Hey, I'm only going to be here for a short amount of time. Is it worth me to come in?" And it's important for people to know that we work with people visiting the area, tourists. Some snowbirds don't like to be called snowbirds, but some people, we use the term visitors sometimes. But, they wonder, is it worth it for me to do any work on my spine in such a short period of time? And one of the unique things that we do in our office is it's not just for scoliosis patients, but for other patients too, people that may have pain or numbness, or other health ailments, that we have short-term treatment plans that our goal is to make a correction in a very short amount of time, and then the patient keeps up with the correction through home exercises. And the extreme side of that would be the intensive care scoliosis patients that we have come from other states and countries, and they will fly in, stay for 2 weeks, do 2 2-hour sessions a day to work on correcting their spine, and then they go home and keep up with the exercises. And we find that that's very, very effective and successful. We also will use that same model, though, with a lot of people that are visiting the area. So people may have sciatic or headaches or some, really unusual postural deformities that they know need to be addressed, but they may only be here for another month. And they're wondering, is it worth it for me to come in? It is important for them to know our goal is to make a significant correction within a month or less, and then for them to keep up with their exercises at home. So it's definitely plenty of time to make a significant change in somebody's health.
That's perfect. So more than worth it to come down while they're here to come down and see you to see if they can either continue to keep up, because I assume there's also things where it's like physical training involved with people. I know we've talked about accidents before, and also, but I lost train of thought there. But also to make that type of, do people come here just to see you? Also, I mean, if these snowbirds are having pain and they've been having pain like that, I know you were just saying that since they're here for such a little amount of time, it's more than worth it to figure out something to bring their homework back home and have that.
Yeah,
option, right?
So the patients, we give them a specific exercise program to work on their neurological health. It may be brain-based exercises. It may be what we call isometric exercises. It may be postural stability exercises. But we give them something very specific for them to help them to achieve their goals. Many times they have aches and pains. Sometimes it's posture. Other times it's scoliosis.
Right. That's good. Okay, perfect. So then, let me see. So that works out well. If people are coming in from town and they already have their own, coming back from, again, visitors, as you say, and they already have maybe their own type of routine coming from wherever they're coming from, is that something you work with? Or
Yeah. So if we see snowbirds, especially this month, we've already had quite a few come in. They may already be under chiropractic care with another doctor, up north. And, we do a detailed consultation to see exactly what's been working for them. And then, create a specific treatment plan for them, whether it's keeping them on track with the preventative care or correcting something that hasn't resolved with what they're doing already. And, many times it's the drive down.
I'm sure.
They will, say, I was doing pretty good, but it was that, if they're coming from, Michigan or Minnesota or, Massachusetts, and, they'll break the drive up a little bit, but a lot of times when they get out of the car down here, pack the car, unpack the car, they're feeling some things after all that, and they're ready to get feeling good so they can enjoy their time here. But we'd like to be more of a lasting effect, to where they're not just enjoying their time here, but they're able to keep it going when they get back home.
Right. I'm curious that you bring that, because you work with, obviously do your own consultation. Do you ever get these instances where wherever they're coming from, whatever the information they're bringing that isn't suited to them, and is that something you have to, I assume, change with them, but also maybe consult with their physician back home, or you
Sure,
just kind of
yeah. We'll get their doctor from up north on the phone and figure out what's working for them. So that's a really important part of listening to what is working for them in the past, and building on that is very important.
That's good. That's good to stay on the same page there.
It's interesting because I find sometimes, both with vacationing, patients and snowbirds, sometimes it's actually easier for them while they're here to focus on making a correction.
Yeah. I get that because they're here for their reason, so it's nice for them to have that time to focus more on on getting better while they're here also, which is good. So
Yeah. So on Facebook Live, while we're on the commercial break, I'm going to go over some postural things that we notice a lot in snowbirds.
So stay tuned, folks. Go on break here the radio, but if you want to keep talking, learn some more things, we'll be on Facebook Live. So stay tuned.
I am Brett Gibson, owner and operator of Gibson
All right.
Heating and Air Conditioning.
One of the things I wanted to talk about with snowbirds that we see is really common as people get older, and it's something that we can help with. You'll see it extenuated in patients with Parkinson's and things like that, but their head will go forward if you watch me from the side view. So every inch your head's forward, your head feels like it weighs another 10 pounds. So if your head is 2 inches forward, it's going to physically feel like it weighs 30 pounds.
Wow.
And at the same time you'll see that happening, you'll notice that people will walk with a wider gait. So if they're supposed to be walking like this, you'll see that their feet are kind of like this, and they're walking like that. And you'll notice that Parkinson's patients, you'll notice that a lot. They'll get the wide gait, and these are symptoms of the cerebellum and the upper neck not working properly. And it's something that we get really good results with. Now, with Parkinson's patients, it's much easier to be preventative. It's much easier to keep a nerve working than it is to get it working when somebody has a serious degenerative neurogenic disease like that. We still get results in that area, and some of the research on that is really neat because it really shows that all the activity that a Parkinson's patient does helps. They have to stay motivated and really keep moving, and it really helps. As people get older and they develop this posture, it'll affect their health and their gait. There was just a study that came out, published by Deed Harrison, who is the CEO of a nonprofit called Chiropractic Biophysics, and he just published a paper, and it showed that forward head translation, the more your head goes forward and you lose the cervical curve in your neck, is statistically directly related to your health. And people will tend to have more heart problems and more health problems the further that head is. Well, why is that? Well, you got your spinal cord in there, right? And that forward head translation is a symptom of the brain not working right? So if you look at, let's say you go to a football game and you're watching people walk around the crowd, the people that have their ear right over their shoulders, they're walking pretty briskly around, right? You'll notice that the people with the head really far forward, they're walking a little slower, right? So there's a direct correlation between this head posture and your health. And what they found was it also is a predictor of how much medication you're on. So the farther your head's forward and the more your posture slumped over, the more likely you're to be on heart medication.
Wow. And it's something like that, you mentioned that when it's going forward, your head, is that something that comes from a type of like nerve degeneration, or is that something that's also like your posture just...
Yeah, so your posture is your brain, right? So when a brain is working really well, you have really good posture.
Right.
When the brain doesn't work good, the posture gets worse. So we're using the spine as a lever into the nervous system. And when we work on people and their posture gets better, it's not just their spinal alignment, but their brain is actually working better, which is really cool. And the better the posture, less medication,
Right.
less likely to develop
hand in hand.
diseases like Parkinson's.
Alrighty, ladies and gentlemen, welcome back into the show. If you did not hop on Facebook Live, missed a nice little tidbit there about the correlation between Parkinson's and other degenerative diseases and heart conditions and possibly leading up to Parkinson's, obviously, and the benefits of good posture. And
yeah, we were talking about every inch your head's forward, it feels like it weighs another 10 pounds. That puts a lot of pressure on your nervous system. Your body consumes a lot of energy. but it also is a symptom of the brain not working right. So it works a lot very well. It works together. So we're using the spine as a lever into the nervous system, and then we have the patient do specific brain-based exercises, which help to hold their spine into alignment. And the recent study that came out that we're talking about on Facebook Live showed that the further your head is forward, and if you have a loss of the cervical curve at the same time, your body is consuming energy and it's putting a lot of stress on the sympathetic nervous system. The sympathetic nervous system controls your autonomic function. Your autonomic function is like when you're not thinking about anything, your heart's beating, your lungs are breathing, your kidneys are working, your stomach's digesting food. These are all the autonomic or the sympathetic, the autonomic part of the sympathetic nervous system. It's making all those things happen. And what they found is abnormal posture interferes with that sympathetic function. So the further your head's forward, the more likely you are to be on heart medication. And it's really groundbreaking stuff. It's the first time that any kind of study like that has ever been published. Chiropractors have been theorizing that for 125 years, which we will be celebrating September 18th of this year, the 125th birthday of chiropractic. But to have a study that actually proves that was pretty cool.
That's incredible to hear that everything will you already kind of know to a degree that how everything is related to one another, but how important good posture is and the work that you guys do can minimize. Obviously, you want good posture, good health, but it's also going to benefit your heart and your entire body.
It just makes sense. It's interesting because in neurology, we'll have problems called ablative lesions, meaning there's like a big herniated disc that it totally blocks a nerve, or a nerve gets cut, or somebody has a tumor in their brain, right? And it's easy for people to think or look in a textbook and say, okay, if we have that, it's going to cause this not to work right, right? Nobody will argue with that, right? It's like a rock on a hose.
Yeah.
If the rock's on the hose, then the flowers are going to die. But when you have what's called subtle neuropathy, meaning the head's forward, right? It's a symptom of the brain not working right. It's traction in the spinal cord. It's traction in the nerves. So instead of your arm completely not working, you may have some numbness and weakness in the arm, right? Mm-hmm. And it's that gray area that really affects a lot of people, but it's not as mainstream.
Gotcha. And going with that, I assume you see plenty of patients that will come in with their head leaning forward. Is that something? What's the process that you would go through to start to correct?
So we do a very specific neurological exam. We do a specialized type of X-ray. That we have a special machine that's aligned in a certain way to do a very detailed analysis of the spine, specifically the upper cervical spine, to look for alignment of the atlas and the second cervical, also known as the axis. And when you have subtle misalignments in that area, it can affect people a lot. So we'll say, in some people's health, a millimeter may be a mile because of the effect it has on them. And then we take that detailed information that tells us how to do the adjustment, and it also tells us how to prescribe the exercises, because that spinal alignment is a window to brain function. And so the patient will have specific brain-based exercises that they'll do along with the adjustments to get everything working again. We had a patient come in recently who was familiar with a study done at the University of Chicago that showed upper cervical adjustments affected their blood pressure. And so when people come in like that, we never tell them not to see their cardiologist or not to take their blood pressure medication, but the studies are out there. And so we started working with this gentleman, and his blood pressure was 180 over 110, and now it's consistently 140 over 90, and he's no longer on medication. And what we'll tell patients is, if your blood sugar is getting better, or if your blood sugar is getting level better, or your blood pressure is getting better, then just mention it when you're at your doctor's office, and just say, can we cut back on this medication, or do you think I still need to take it?
Mhm.
But I'm never going to tell them. I'm just going
Right.
to work on
Yeah.
correcting things and making it as good as I can get it. And then if they happen to improve their sympathetic nervous system to the point where they can reduce some of that medication, great. Because we know that the more medications people are on, the more side effects they're going to have,
Mhm.
and they're just not as healthy. If you look at those people that are walking fast, in the mall or at the
Mhm.
football game,
Yeah.
most of them are on less medication. If you look at the ones that are pushing a stroller in a wheelchair,
Hunched over.
chances
Yeah.
are they're on more medication than the one walking straight.
Gotcha. And I'm curious, I know you go through these extensive neurological exams, and you do the x-rays to set up the physical training or the exercises to get better. But I know last month when you were here, we talked about the Scoli brace that you have. I know that improves, obviously that's more towards the scoliosis and your spinal structure, but do you have any type of brace or spinal setup also that'll improve the posture, set back the shoulders, and
So,
also do something like that?
Yeah, if it's mainly head forwardness, we won't do any bracing for that.
Mhm.
From the side posture, some patients have a severe kyphosis where they're really hunched over in the middle back. Sometimes we will use the Scoli brace for that.
Okay.
But the Scoli brace is mainly for people that have severe scoliosis or if they have ligament damage in their spine. So we'll see one segment actually slipped sideways, and so the Scoli brace is like an alternative for surgery for those patients.
Yes, yeah.
And it can really help them get around significantly better. And there's two types of scoliosis. There's the kind that you're kind of born with, and then it may get, or not born with, but it develops and gets worse during puberty.
Mhm.
And then there's adult onset scoliosis, where you get one segment that's degenerating, and all of a sudden there's a scoliosis there. So the patient's 60 years old, they go get a physical, they get x-rays, and no scoliosis. And then they go back to the doctor when they're 70, and they're like, you've got a 30-degree scoliosis. And the patient's like, what?
Wow.
I never had scoliosis growing up. Well, what happened was one or two of the segments in the spine degenerated in a lopsided way, and all of a sudden this curvature was created. That degeneration can then affect nerves. They may all of a sudden be getting hip pain, knee pain, numbness, tingling, and sometimes it's not that they have a knee or hip problem. It's actually referred pain from their spine related to the scoliosis. And those people do very well with our type of care, especially when they've tried other things. They've been to the PT, they've had an injection, they're told they didn't need surgery, and those things get better with our care.
That's incredible. It's important to over time to visit you, whether or not you have this, like the severity of scoliosis,
Mm-hmm.
just because it degenerates over time. So
Yeah,
like,
yeah.
So
Symptoms are a very bad way to judge our health. Most cancer is diagnosed on symptoms.
Mhm.
Most the first symptom of heart disease is a heart attack.
yeah.
So symptoms are not the best way to judge your health. And with your spine, 90% of the nerves have to do with controlling all your bodily functions, like this study just showed, the sympathetic
yeah.
nervous system. Only 10% of your nerves have to do with pain. So you can have a lot of misalignment created without getting any pain. Think about it like you go to the dental hygienist, right? Your teeth feel fine, right? And the hygienist is sticking that probe into your teeth,
Mhm.
and all of a sudden you're like, what was
gases.
that, right? Well, those you got to have a lot of tooth degeneration to feel pain,
Right.
And you have to have a lot of spinal degeneration to feel pain.
Mhm.
So waiting till you have pain, makes it a little more difficult because there's a lot of memory that's been developed there, degeneration,
Right.
muscle
Your body's not
problems,
used to that, so.
brain memory and things like that have to be addressed.
So there's that. I don't know if it's a type of stigma or anything, but that's why it's important to, like, you go to the dentist every 6 months or so. But it's important to also visit you guys as often as possible. So that way, that's a great metaphor for that, honestly.
Yeah, our goal is to get a correction on the X-ray, have the patient symptom free, then start to check them once a month, and then we can reevaluate how they're doing, and we'll see if their stress level requires them to get checked more or less than that.
Mhm.
But once we're at that monthly point, we're going to use more some of their physical findings to determine their treatment plan versus symptoms.
That makes sense. So these 30 minutes fly by, Doc. Anything else you want to get on there? I know the 25th birthday is coming up for September 8th or in September.
Yeah,
You guys have anything
September
planned coming
18th of this year will be the 125th birthday of Chiropractic. That's it. You can find us at drjhartley.com, and we're over by the Hippo Cafe on Tree Boulevard in St. Augustine, Florida.
There you have it, ladies and gentlemen. Another first Tuesday of the month with Dr. J. We'll catch you on next time.
St. Augustine, Florida, and